Hello, good morning, everyone. Thank you for joining this session. My name is Pharmacist Kazim Abdugeniu. I'm also called the on-air pharmacist, and I'm here to guide us through a series of sessions in our smoking cessation support program. This session has been um, ideated based on the growing menace of smoking um, among people around this area, but more importantly, because of their struggle to quit smoking without support. It's been said that over 11 million people smoke in Nigeria, and just 5% of this population have access to smoking cessation support program. So this is a way of trying to bridge the gap and trying to bring support to people in this regard. So before we go into the support that we need to give, it is also important that we get to um, understand tobacco use and addiction. I would want to say that a lot of people have different reasons for smoking. One of those reasons is biological factor. And basically, we're talking about how the brain of human responds to, nicotine that is present in tobacco. And that might create some kind of reasons for people to want to smoke. Biological factors, the stress relief some people perceive they get from smoking cigarettes would make them to go back to it over and over. And of course, boredom. When people get bored, sometimes they get to engage in, people. They've said that idle art is a devil's workshop. So you get to engage in some activities that becomes an habit over time. Social factors such as peer influence, wherein friends do influence each other to take cigarettes, is also very important as one of the reasons people tend to smoke. There are the means of increasing advertisement on our media, even on social media these days. We get to see people, ceremonizing or celebrating smoking, even in our movies. In our movies, the home videos, and all of these that we have around, they get to celebrate smoking. People now, even musicians on stage, they smoke cigarettes now, smoke even more, something more than that, just to and that's also influenced the way people take tobacco smoking. Some other issues such as situational triggers. Some people have engaged in smoking because after eating they get to feel in a different way, and because they've started using it accidentally, probably they get to go back to using cigarette again. Social events when people gather in their numbers, of course, a lot of people will do some things within that area that might make someone around want to also smoke. For some persons, it's a routine for them. They tend to smoke maybe in the morning, and it becomes an habit, and that's it for them. So the brain that we talk about, the psychology, the physiological or the biological factors that we mentioned. When someone smokes, it stimulates the release of dopamine hormone, a pleasure hormone in the brain, and that leads to cycle of dependence, because after smoking, there's a feeling that comes with it, the feeling, and of course, once the smoke, the feeling is over, there's craving for more, and persons repeat the act again. And when they withdraw from those activities, it becomes an habit for them. Over time, the brain also adjusts, requiring more nicotine for the same effect. What this means basically is the fact that when you take cigarettes or you take nicotine, whatever form that you have taken them, um, you get used to taking it, and after some time, you would want to. Um, yes, sir. Okay, so going back to where we stopped, dopamine triggers, cravings, and it goes on and on. And when the person withdraws from not taking nicotine, they get anxious, they get irritable and restless. Of course, we must have seen this in our environment. Also, the health risk of smoking is also one of the reasons why we are interested in this cessation program, because in the short time it increases our heart rate. When we smoke, our heart rate becomes increased. Of course, we get to perceive the bad breath that comes from smokers around us, and this doesn't come so easy with them too, in the sense that there's reduced lung function. They get to breathe, abnormally, and that in the long run could cause lung cancer in these patients. It could cause COPD in these patients, and even in some cases, heart disease. Now, the most striking part of this whole thing is the fact that smokers themselves put others at risk. So it's non-smokers that are around the second smokers around them, people that are not actively smoking, but are just around people that smoke, tend to have some level of harm as well, in the sense that it increases the tendency of having heart disease or even cancer risk in this population. Now, it's important to also mention that a lot of people have attempted smoking, but however, the myth that is understood by them is that the only way they could quit smoking is just to abruptly withdraw from smoking, which is actually not the truth. And to them is the only successful way of getting about that. But the fact remains that withdrawing bit by bit has been found to be very effective, in addition to behavioral support that we are offering right now, and maybe medications. And when this is done, it doubles the success rate. So if we had only 10 out of 100 able to succeed in smoking before now, it doubles it if we are able to include all of these approaches. Another myth that is very common among us is the fact that people tend to use electronic cigarette like or vaping, and they consider this as one of the easiest way or one of the safest alternative to smoking cigarettes. This is not true, because it also has harmful chemicals contained in it. Now, when you take cigarettes, when someone takes cigarettes after 20 minutes, the heart rate normalizes, and then they actually normalize it. And in 24 hours of smoking, the carbon monoxide level drops. After 1 year of taking cigarettes, the incidences of heart disease reduces. And after 10 years of quitting smoking, the risk of developing drug cancer drops significantly. So